Dr. Burgess from Texas for 5 minutes.
Thanks, Chairman, for the recognition. Thank you for doing this Member Day. Mr. Womack, I've attended these before when you were chair and enjoyed them. I like what you've done with the place. It certainly seems to have, I guess it was included in the budget. I want to share my thoughts about the budget resolution for fiscal year 2020 and concerned about this committee's interest in pursuing single-payer government-run health care. Health policy has a budgetary component, I accept that. But on the policy side, our committee, the Committee of Energy and Commerce, is one of the principal committees of jurisdiction that involves itself deeply in the genesis and management of healthcare policy. Look, the Democrats' one-size-fits-all government-run single-payer healthcare bill would be an epic fail to provide access to quality healthcare for Americans. I hope I'll have the opportunity to answer the questions, Mr. Womack and Mr. Johnson and Mr. Roy. I'd appreciate your question as well. But this plan will lead to a massive tax increase. It will eliminate private insurance, and it will accelerate the pending bankruptcy in the already dwindling Medicare Trust Fund. The constituents in my district are struggling. They're struggling to afford their health insurance, and I am sure that my district is not the only one where people come in to me complaining about their high premiums and their high deductibles. What good is healthcare insurance if you are afraid to use it because you cannot afford your copay or your deductible? This is an issue that I would like to see us tackle, and I am confident that a government-run single-payer healthcare system would only further erode our nation's healthcare. I am the son of a physician who chose to leave Canada's government-run healthcare system behind for the United States. I worry that the central state control of healthcare as it exists in other countries would be damaging to the doctor-patient relationship. As a physician, I do not believe that the government should interfere or hinder a doctor's ability to act in the best interest of his or her patient. I wish the concept of a government dictating a physician's practice and decisions was unthinkable. However, I find myself here today having to deconstruct the idea of further government control of healthcare. A proposal by one of the members of your committee would implement a global budget. And once that is set, hospitals and institutions would be required to stick to it. You know, it sounds like a block grant. Maybe that's a good thing. But there's another part of the bill that talks about making this expenditure an entitlement. So I'm a little confused, is it a block grant or is it an entitlement? And as this committee knows better than any committee in the United States House of Representatives, the thing that is driving our debt and deficit is that expenditure which is already baked into the cake over which we have no control. It is that 67% of the budget that is on autopilot, that's on automatic spending. Today, we should be focusing on parts of the health insurance market that are working for Americans. According to a survey from America's Health Insurance Plans, over 70% of Americans are satisfied with employer-sponsored health insurance. And it provides robust protections for individuals. And guess what? There's no prohibition on covering, or there is a prohibition on failing to cover pre-existing conditions. And that's not the Affordable Care Act, that's the ERISA law. That's Senator Javits' legislation from 1973. Quite simply, the success of the employer-sponsored insurance market is not worth wiping out with single-payer health care. Since President Trump took office, the number of Americans having employer-sponsored health insurance is between 2.5 and 5 million more than it was just a little over 2 years ago. That's more than at any time since 2000. Democrats want to abolish that type of insurance entirely. Look, I was the senior policy advisor, health policy advisor for Senator McCain's presidential campaign. Senator McCain proposed a plan that would impact ERISA plans, and I learned firsthand that's not something that you want to mess with. People don't take kindly to you changing their employer-sponsored health insurance. So instead of it building on the success of our existing health insurance framework, this radical single-payer government-run system would tear it down. It would eliminate employer-sponsored health insurance, private health insurance, and popular Medicare Advantage plans. The single-payer healthcare system would be another failed attempt at one-size-fits-all Americans are all different, and a single-payer healthcare system will not meet the varying needs of each and every individual. Single-payer is not one size fits all, it's one size fits no one. I'll be happy to take your questions.
Does any member have a question of the witness? The ranking member.
Dr. Burgess, the same question I asked of Dr. Bucshon, and that is, what in your opinion are the second and third order effects of a Medicare for all in whatever form and the provider community?
So how much time do you have? Look, people don't hazard big things for no gain. It is true that some of us who went into medicine went in for the most altruistic of reasons. We wanted to help our fellow man. It really wasn't a concept of earning a good living in that profession. It's because it was what I was, almost if it was in my DNA, it's what I was born to do. I'm the son of a physician. My grandfather was a physician. That's what I was destined to become. However, as we've seen today, I mean, it costs a lot of money to go to medical school. I mean, our students are finishing medical school in their residences with crushing amounts of debt. You can't expect them to take on that kind of liability, which basically will subjugate them the rest of their lives if you're not willing to pay the freight on the other end, on the compensation side. And as we heard from Dr. Bucshon, the expectation is that in a single-payer government-run system where there is no, you just take, you become a price taker. You take what they're spending. And also, I think the bigger question is, what would you do to actually make things better? And this is what I never understood. Of course, I wasn't involved when the Affordable Care Act was written. I wasn't invited into those closed-door sessions. But when you look at the success of the employer-sponsored health insurance in this country, and again, over 70% now covered with employer-sponsored health insurance, the favorability rate is off the charts high, and you will find that out when you go to take it away from people because they'll be mighty upset. Why did we not look at expanding the availability of that type of insurance? In the individual market, it's an entirely different situation. And so for those individuals in the individual market, yeah, they do have exclusions for pre-existing conditions. There are things where the insurance companies have made some rules that are perhaps not consistent with good health and benefits. However, this House, or the House under Republicans, almost every year that I've been in service here, has passed a bill that dealt with association health plans. Association health plans would allow small group markets and individual markets to buy into, to pool together and buy into those large group markets with ERISA protections, protections against exclusions for pre-existing conditions that have been in existence since 1973. Why wouldn't we have done that rather than what was done? And the answer to that question is, do you want the individual or the individual in concert with their employer to be in charge of their health care, or do you want the government to be in charge? And if the answer is you want the government to be in charge, then no, you don't care anything about employer-sponsored health insurance, and you're willing to take it away from people, even at some political hazard and peril, and I guarantee you there's political hazard and peril if you go down that road. But why wouldn't you provide something that people actually like and what people actually want? The big fail of the Affordable Care Act is that you provide a subsidy and a mandate and you've destroyed, of course, the market. Why would an insurance company sell me something that I actually wanted to buy when I've got to buy what they're selling under penalty of law, or I'm going to get a big fine? That's what is so baffling about the system that we find ourselves with today. And we're going to make it worse.
I thank the gentleman.
Thank you.
Thanks. Mr. Johnson.
Dr. Burgess, you're not very passionate about these things, are you?
Well, I think about it from time to time, but otherwise, I'm just worried about how we broke the internet. It doesn't work anymore.
Yeah. Well, I appreciate your passion. Our Republican ranking member, Republican leader, asked the question about how it will affect, how Medicare for All will affect the provider community, and you're a member of that provider community. What happens to the patient? I mean, if we see what many are projecting could be as much as a 40% decrease in in payments to providers under a Medicare for All scheme, which will not cover the costs of operating their practices. What is that going to mean for the millions of Americans that call themselves patients?
Well, let me take this in two parts. First off, just the effect on the practice of medicine. I thought it would take longer for the deleterious effects of the Affordable Care Act to affect my profession. It was astonishingly fast. And I don't know whether it was by design or was a defect in the Affordable Care Act, the facilitation of consolidation in the healthcare marketplace. Doctors purchasing medical practices really has taken off. I get it why a doctor would enter that type of it's just too darn much trouble. I'm having to, spend all my energy trying to take care of sick people, and I don't have time to deal with the insurance companies and every other aspect. The hospital wants to buy my practice at a tidy sum. I'll sell it to them and I'll just work for them. But here's the problem with that. Our contract's always with the patient. It's not with the hospital, it's not with the government. No man can serve two masters. As a physician, my contract must be with the patient. I must always keep the patient's best interest at the front of my mind, because if I don't, if I'm only worried about what it's going to cost the hospital or how can I make more money for the hospital, perhaps if some additional tests that can be ordered drives the cost of the whole system upward, it's not in the best interest of the patient to have the doctor working for anyone but the patient. And that's one of the things that I think we have to keep in mind.
This is a little bit anecdotal, and I know that's dangerous in a hearing to go.
Plural of anecdote is data.
Anecdotal. But, I mean, life expectancy in the United States has tremendously increased over the last 4 or 5 decades. We talk about Medicare and Social Security, and when those programs were put in place, people were living into their 60s. Now people are living into their 80s, 90s, and I got people in my district that are popping 100. There's something working in America's healthcare system, that Americans are living longer because of improved health outcomes. Why do we want to tear that down?
I don't have an answer for you because it doesn't seem wise. I did hear Mr. McGovern made the statement that life expectancy was decreasing. There's no question, and you know this, the opiate epidemic has in fact had an impact on life expectancy in this country. But the general thesis that you're putting forward is absolutely correct. And, we just had that hearing on vaccines in our committee. We forget the number of children we used to lose to vaccine preventable injury just a few short years ago. And those lives are not lost today. Not this Congress, but the United States House of Representatives passed a big bill right at the end of 2016, right at the end of the Obama administration. It was signed into law by President Obama. I think it was one of his last bills, called Cures for the 21st Century. We worked on that in our committee for several years. Mm-hmm. And you think about the number of big breakthroughs that are just tantalizingly close, and Cures was to bring them even closer and deliver them to patients so they can begin making an impact in their lives. I look at that through a provider's eyes and say, this generation of doctors that's coming up, they're going to have tools at their disposal to alleviate human suffering that no generation of doctors has ever known. That's the good news. And we, the United States of America, the United States House of Representatives, is making that investment and bringing those things ever closer. And that's a good thing, and we should all celebrate that. We're going to have to figure out on some of the cost parameters, as we saw with the breakthrough drug that cured hepatitis C. Boy, it nearly bankrupted some state Medicaid programs. They weren't expecting that. So we're going to have to better communicate those things that are just around the corner. But it's going to be it will be a true golden age of medicine.
All right, thank you. I yield back.
Gentleman's time has expired. I just want to correct one little comment that you made, and it was related to the Affordable Care Act when you said you were not invited into the room. You may not have been specifically, but to create the impression that that was a closed process is There were dozens and dozens of hearings on both the House and Senate. There were markups. I was on the Ways and Means Committee at the time. We had a meeting with all 45 members, Republicans and Democrats. We asked Republicans, is there any way we can write a health care reform bill that any one of you can support? They said no. They didn't want to participate in the process. That was the reaction we got consistently. Republicans were consistently invited into the process and refused to participate. So
I can't, just if I may, I can't speak for the Ways and Means Committee. Yes, the Energy and Commerce Committee did have a several-day markup, and Chairman Waxman did entertain a number of Republican amendments. But as you'll recall how that all played out, it was a bill that passed on the Senate floor on Christmas Eve that was delivered back to the House, and all of the work that the House had done the year before going into that, good or bad, was then done away with, and we just had to take or leave. It was the Senate bill, take it or leave it. And I remember Speaker Pelosi's comments when that bill came over from the Senate. Well, I haven't got 100 votes for this damn thing over here, and she didn't until they worked on people and eventually got it passed, and it was a strict party line vote.
right. Well, we'll have plenty of opportunity in the Congress to debate the future of healthcare. we need to move ahead.
Mr. Chairman, I would
Yes,
like
Mr.
to
Roy.
address my colleague from Texas, if I might. Thank you. Wanted just a couple quick questions for you, Doctor. Thank you first for dedicating your life to the care of others and to healthcare, and obviously serving here. Thank you for your time here today. I would note I was not in Congress in 2009. I think my observation as a spectator, as a federal prosecutor back in Texas, and just watching public policy from Texas, was that clearly that was passed on a strict party line vote, that it was put through in a process that was questionable at best, and that Obamacare, which you would think when it was passed and implemented to pretty much, start the slow decline of destroying our healthcare system, the private healthcare market, would in fact been something that we tried to be done on a bipartisan basis, not a partisan basis. Am I missing anything in my assessment of how that was passed in 2009?
Well, and fortunately for you, we have a good example of healthcare policy that did proceed on an open and bipartisan basis, and that was the Medicare Access and CHIP Reauthorization Act of 2015. Got rid of the sustainable growth rate formula, something I'd fought for all the time that I'd been here. And it got 393 votes in the House and 92 votes in the Senate, so it had significant broad bipartisan support. And the important thing there is, and we know this, when we do big, especially healthcare policy bills, but in other areas of policy, we do big stuff like that, it gets over to the agency, and they start interpreting it, and if it's really big and vast, sometimes they interpret it in ways that, oh my gosh, where the heck did that come from? And I have seen this personally with the Medicare Access and CHIP Reauthorization Act. You'll hear doctors complain about MACRA and MIPS back home, and to be sure, it requires constant vigilance on the part of the committee. We've had 4 oversight hearings on MACRA, and there has been bipartisan input in trying to fix the problems as they have arisen. So if you do something in a bipartisan fashion, you have more equity with which to work going forward when the inevitable problems of implementation, when those occur.
So a couple other quick questions. We've talked a lot about the costs since we're here in the Budget Committee of something like Medicare for All. We're aware there are a lot of reports out there. $32 trillion is at least one assessment. I've seen $40 trillion. Are you aware that even Senator Sanders, who puts out his full support for Medicare for All and was one of the original proponents of it, that even on his own website he would suggest that it costs $1.38 trillion per year over 10 years. In other words, $14 trillion. So even his own promotion of it would be another $14 trillion, i.e. more than our annual deficit right now. Would you agree that that's the bottom line assessment of the cost, but the actual cost is more along the lines of Mercatus' report or others at $32 or $40 trillion?
We historically underestimate the costs of these programs.
No way, in Washington, D.C. And then the question, we're talking about private markets and healthcare. Would you agree that the purpose of government is to protect the inalienable rights and protect our liberty, that that's the reason our government exists? And are we aware that under Medicare for All, that we're pretty much going to outlaw private insurance? That's the purpose of it, is essentially to outlaw it and leave it at best at the margins as an additive.
So if the question is the government too big, too small, or just the right size, I think you and I would agree that it's too big. And you would do nothing towards right-sizing that government if you were to add to it the part of the GDP that is composed of healthcare in this country. It will inexorably rise and rise to a level that I think is almost incomprehensible, but it will, you know, we talked about banks that were too big to fail.
Right.
We've got an agency over there that's too big to work.
Right.
How, you know, this should be devolved to the states. We should look at ways to help our states put together the programs and let it work on a more local level rather than all over at the Hubert Humphrey Building or some place up in Bethesda.
And finally, would you agree that, and I've had a number of people talk about, quote, the wild, wild west of healthcare prior to Obamacare. Would you agree that in 2008, prior to the implementation of Obamacare, that we had an overwhelmingly regulated healthcare market from UMRA and HIPAA and EMTALA and you know, all of the additional regulations that have been put on place from Washington, D.C., such that you didn't have a functioning market to drive costs down in 2008, and that has been made inexorably worse by Obamacare, and so that anything going towards Medicare for all will make it even further more regulated and increase costs to the taxpayers? And that's my last question. Thank you, Doctor.
Throughout my professional political lifetime, healthcare has been one of the most intensely regulated aspects, you know, of any type of business in this country.
All right, the gentleman's time has expired. Anyone else? Thank you very much.